Hello, I am Dr. Kimberly Leupold with Holistic Healthcare Centers, and I have the awesome pleasure of working with nurse and provider Penny Leupold, who's also my mom. So something that's super fun that we've been doing since 2013 or 14, I don't remember, it's been so long, is working together. At times she has had to take a hiatus to be helpful in other ways, but she has been a provider with Holistic Healthcare Centers since 2013. And one of her specialties is energy therapy. So what's really awesome about my mom, well, I mean, there's so many things, but one of the things that's awesome is that she has 30 plus years of being a nursing professor and clinical nursing experience, combined with being a certified Healing Touch practitioner, both in Healing Touch International and Healing Touch programs.
Healing Beyond Borders.
Yep, that's, and so she can blend that, the science, just like our title says, synergy and science, she blends them so well. She's even taught RNs while she was a professor, you know, how to do healing touch, or at least different modalities. So can you tell us a little bit about your experiences, Nurse Penny?
Which experiences would you like to know about?
How it feels like to work with a patient. When a patient comes in and they're very analytical, very science-minded, they are more kind of attracted to your care knowing that you are an RN, but are now coming to
First,
you.
I would ask them why they have come to me and what they're hoping to achieve or gain. I would then explain to them, especially if they're very analytical, how the energy works, how our bodies work. There's some science behind it, but it's not all just science. Some is knowing and understanding.
Intuition, which now can be proved by science.
Guidance, yes. We know that energy, we're all energetic beings. Everything has an energy flow, an energy color, an energy vibration, and I would probably work along those lines, explaining it.
So if I was a patient coming due to migraines, and my migraines were elicited strongly by stress, and maybe I'd been through a really stressful scenario, and I came in and was getting acupuncture for migraines, and I felt like I just wanted to get an even stronger treatment for my mind, body, spirit, and an even stronger treatment for the stress level. So then you wound up coming in and doing the energy work. How would you be helping my migraines? What does that involve?
Well, one of the things that energy work, subtle energy work, healing touch, which is what I do, but there's other forms of it, works synergistically, very complementary with acupuncture, with allopathic medicine. They all work very nicely together. I would probably I would assess your field.
And what is my field?
Your field is the energy of you. The energy, you extend your arms out, that's about how big your energy field is. Above you, below you, the whole length. I would assess how you feel.
May I ask a question?
Yes.
I heard through Healing Touch classes that a great way for people to kind of conceptualize the concept of a magnetic field is to look at the candle and all the energy, and then the heat around it is kind of the same concept of us warm-blooded human beings.
That is absolutely. The other example that I use for energy fields, you're sitting at your desk, like right now I'm sitting looking this way, and all of a sudden I get the feeling that there's somebody that maybe stepped into my office or behind me, and there's maybe a person back there. That is their energy field entering my energy field.
Yes.
And we all have that experience.
Just like when somebody, I don't know anybody super high energy that works here, but when somebody high energy comes in and maybe you're relaxing in an acupuncture treatment, if I walked out myself, or one of our other providers is also super high energy, if we walked in and we were in that high energy vibration, what I've noticed, and I think you've noticed, is if that were to happen, that patient will know, like, all of a sudden it'll kind of almost take them out of their peace because they feel that. Don't worry, I don't do that now. That was when I was first starting. Back in 2013. But so you even learn to modify your own energy because you see the impact it makes.
Yes, you have to sometimes pull your energy back in. Before I ever do energy work with anyone, and probably going into other meetings, whatever, I always work to balance myself, pull my energy, or sometimes I have to expand it. You know, it's kind of like we talk about being big to be around somebody who's more intimidating,
like ruffling your feathers.
Fluffing your feathers, or it's like, okay, let's pull it in because this person does not need me to explode all over them. Mm-hmm. You know, I've had the experience where some people with high energy literally take my breath away. You know, and it's like, I need you to move back.
Probably Paula, our massage therapist.
Probably not. But that is what energy does. And so when if you were my client, I'm feeling your energy. I also check your energy ports, or what we call the chakras, and there's 7 main ones, and there's a lot of minor ones, anywhere there's joints and different organs. And I would assess those, and it's like from how grounded you are to how much you maybe float into the
ethers,
out into the air type of thing.
And so if you're treating a patient with a migraine, or doing energy therapy with a patient with a migraine, won't it hurt if your hand is by their head? Like if there's energy coming off their head?
Well, yes, because probably if they have a migraine, there is nothing but energy, of pain energy coming off, and we call those pain spikes. And with those, I would probably, first if I was working with a patient with a migraine, I would work to ground them very much and draw the energy down through their feet and kind of like just send it on down, because I'm, as an energy worker, a conduit. I'm just helping your body put things into place and move the energy where it needs to be. So migraine often is just too much going on up there for whatever reason, so you try to pull that energy off. Then I would go out and I would try to find where the pain spikes are, where it hurts. Sometimes the patient can tell you, but sometimes the pain spikes are in different spots even. And then you start trying to break those off. We call them, depends on who you're listening to, chopping it, unruffling it, kind of smoothing it away, and kind of breaking down the pain spikes to get down so that you can get your head, or the pain back in balance.
And clinically, we watch a great shift in patients when that happens. I mean, I know for myself personally, when I've had migraines and you work on me, it's extremely effective. But, viewers could say, oh, well, that's because you do this and you believe it. And we've had patients that aren't so sure about energy work, but are so desperate with the pain levels that they have that they'll do it. And I think some patients are very interested in it. Some patients feel like they don't know what else to do, so they'll just give this a try, mine as well. And it's amazing. You just see the whole complexion change of the patient.
Oh, absolutely. The posturing, you watch, when you've got a bad headache, you're all like tight, and pretty soon you see the shoulders coming down, the breathing smoothing out. And, sometimes it doesn't happen in just one session. That headache that has been there, or, for whatever reason, sometimes it's hormonal and you can help it, but the hormones have to shift also.
Right.
Or it's been a food that you've eaten that's caused it. But you can help the body flush that. There's different techniques.
And if there's environmental stress that keeps eliciting it, or computer work, that's one thing that I've noticed, and that our patients tend to notice, is while they're moving through something, or keep having the pathogenic factor, so maybe it's the job, or it's the stress, or it's the sport they're doing routine appointments for a bit of time makes a big difference. It's not always one and done, as much as we'd like that to be.
If it's just one time I've got a headache and a really bad headache, maybe we can smooth that out. But when there's a history of migraines, it's not that simple to just make it go away, and maybe make it go away for the moment, but not for the long term. You need more.
Well, I have an idea. We have Paula, our massage therapist, standing by. And Paula has been learning energy work. Yes. She's Healing Touch Level 3. She's expanding her energy work. And my mom does energy work. Penny does energy work. So I was thinking maybe Paula would want to sit down. I also do Healing Touch, so I can hold the head and do kind of some of the modalities. We're not going to do too much because we don't want to step on anybody's toes with Healing Touch. But we can kind of just show how just balancing the head can make a difference. So, Miss Paula. All right, so Paula is going to be our demo patient right now, or client when it comes to Healing Touch. We also do Reiki, somatic experiencing, energetic transformations here at Holistic Healthcare Centers. And one thing that you had talked about, like, so let's say that we've got rid of the pain spikes. Let's say that sweet little Paula was having a migraine. The pain spike's gone. She's come back a different day. And she's, I'm just so stressed, which there'd be no reason to be stressed when you work here. But you're just so stressed. And you just want us to kind of help you center. So some things that we can do that are involved in like the modality we would do, we're not going to do the full modality, but sometimes we hold the head in this position. Can you explain why?
What you're trying to do is bring in the right and the left side. You have a right hemisphere, you have a left hemisphere, and so you bring it in, and as you're feeling, as Dr. Kimberly would be coming in, she would be feeling to see if she's, nothing's on this side, and there's a lot of energy, fuzz, what we call fuzz or shocks on the other side, but bringing it in to bring into balance. You bring the right and left, you bring the top to the bottom, front to back, and there's also techniques that we use where we're also balancing your hands, because the meridians start at your head and work all the way down, and try to bring the energies to bring balance, equalization of each side.
And what does this feel like, Paula?
It feels like it's calming things down. Yeah.
One of my patients once, because Dr. Kim will do from side to side, and she said, because she was extremely anxious, had a really bad headache, and when I did the side to side technique, after I'd gone through a couple other motions, she said, it's like someone just pulled a white screen down and everything just went away.
Yes.
And it truly is kind of one of those experiences.
Well, thank you for listening from Holistic Healthcare Centers with Nurse Penny.
Nurse Penny.
And massage therapist Paula, and myself, Dr. Kimberly Leupold. And behind the scenes, office manager Lisa. I'm getting my squats in.